When Mara was born, I remember listening to her heart, one of the nurses allowing me to listen to her heart, and it sounded like a washing machine. We saw that we weren't going to be able to support her without a trach. We started receiving training by Cindy and Jody here at McMaster Children's Hospital on how to care for the trach, how to troubleshoot problems with a ventilator. Later, as we progressed in our training, we started to look at potential scenarios. In this hypothetical scenario, that the bulk of my time, had this been a real scenario, would have been spent running back and forth and gathering gear.
I would help with discharge planning on the ward, and recently we had cohorted all of the tracheostomy patients to the ward in hopes that we would improve patient care and continuity. And so when we did that, the staff had noticed that the equipment was all in different positions of the room and different areas of the room. It wasn't consistent, so it was difficult for nurses to be able to predict where to find the equipment. We did some simulations to assess the room setups, and we also incorporated our families as well, because we thought that it would be great to have their perspective and their lens.
There's a limited scope of emergencies that we're prepared for. Let's say this is going to encompass 95% of the problems that we're going to have with a trach. If I can have a piece of equipment that's light enough and portable enough, which contains all of the gear, everybody knows where the pieces of equipment are, then there's no anxiety in pulling together gear in an emergency situation. I settled on this tackle box where I liked it because I had compartmentalized trays, and I could set up everything for a trach change in that one tray.
I had spoken to Christian and asked him if he could bring his go bag kit that he had developed. When we evaluated it, it was discovered that the current system that we use, a go bag kit, that it became problematic in that it was difficult to find supplies quickly in an urgent situation, and it delayed the onset of using that equipment in emergencies as well. And when Christian came and joined us and brought his kit, we thought this is a great time to show that kit to see if we can actually improve that process. And we did identify that it did improve it and actually implemented change. I think CQI is an excellent platform to problem solve with staff, to identify issues that we can solve, and I think the outcome is, from my experience, has been very positive. From
the very beginning of our interactions with the hospital, there's always been a commitment to continuous improvement. Everybody was willing to incorporate new ideas and new thinking into their day-to-day activities and make things better for the patients.